I'm Dr. Natasha Iyer of Better, where you can feel, look, and live better. It's our mission to help educate you and give you real life day-to-day strategies that you can implement easily to feel better than ever. With me is Dr. Shabnam Das Kar. She's our Director of Medical Education at Better. I love that we stay cutting edge with information, and it's mostly thanks to Dr. Carr because she's a geek.
I'm proud to be one.
And I'm so proud that she is one.
Thank you.
So Dr. Carr is addicted to reading the medical literature. And today she was talking about lipidology and HDL and its role in the immune system and all of that. And I love that kind of information, but I want her to just tell me. And I want to be able to work with you one-on-one and help you get results. But we can't do it without staying ahead of the game. And so today, Dr. Carr and I were talking about one of the biggest challenges people have when they come to us, and that is sleep. Almost every person that comes to us has some sleep disruption. And one of the most critical things to know is that another real big issue that people see us for is weight loss, or the fact that they can't lose weight. They've tried everything, they've done everything, they've been on every diet, the weight either plateaus, it goes away, and it all comes back. And sleep is one of those critical little things that sabotage your weight loss. It sabotages your hormone health and well-being. It sabotages everything if you don't sleep well. And sleeping is not just sleeping. It has to be restorative, refreshing sleep. So Dr. Carr, can you tell us a little bit about what this thing is, sleep hygiene? Because I tell patients go read about it, but maybe you could just teach them about it.
Okay, so many of you probably do know what it means. It's like simple things that probably you go out of your doctor's room with a handout telling you all of that. But what are the important things? Now, we say the simplest way to describe your sleep hygiene is you should be sleeping in a room like a bear in hibernation. So the temperature should be a little lower than you're comfortable at. And more importantly, it should be completely dark. So none of those lighted devices, no charging your mobile phones next to your ear. Preferably, it's better if it's in another room because you don't want any of the blinking lights. And the reason for that is those little blinking lights at night can affect the melatonin secretion. And many of you are taking melatonin as a supplement to help you sleep better. But of course, melatonin has a whole bunch of other benefits too. It's a master antioxidant, and it is not a sleep medicine. So it's not an addictive substance. It's something your body is supposed to make by itself. But with age, sometimes melatonin levels go down. And another major factor is the ambient light. Light at night is what we call it. So the ambient light nowadays, if you look at one of the maps worldwide, and Dr. You and I have discussed this a lot about breast cancer incidence and the ambient light, it's unbelievable. And if you think back to your time, many of you grew up in farms. How much of light was there outside? Hardly any.
But even in towns, you had the odd street light. But now you can go to bed and the whole room is still light enough you can navigate in the dark.
Exactly.
In the dark. It's not dark. In the light.
In the light. And the other thing is no television in the bedroom. I don't think that's a major challenge for most of us.
You'd be surprised. I mean, I like to do exactly what you say. My room is for sleeping and that other thing only. Two things
so
happen
Dr.
in the bedroom.
Iyer means it's sleeping and intimacy only. Okay, and very importantly, one more thing is a lot of us have this habit of, last thing we do before we sleep is check our lighted devices. So it could be a mobile phone, it could be an iPad. If you're reading on an iPad, that is not something that's recommended. And there have been studies which have shown that it affects your sleep, it affects your melatonin levels as well. If you're reading in bed on a lighted device. Now, there are some devices which don't have a backlight. So that is okay. And actually, after reading that paper, I made a mental note of not reading any device on bed. I'd much rather read a printed book. So that is the other thing. And one more major important thing is probably you need to do something like switch off. You need to decide on a switching off time. Switch off your television, switch off your mobile devices, switch off your laptop at least an hour or maybe 1.5 hours before bedtime. So it's kind of like your, the bookends. You start your day a certain way and you end your day a certain way. That is going to give you much better quality sleep. And so those are some of the smaller little, and not that it's not that everyone's going to be helped by just doing these simple things. Most of you have probably done these simple things. One more thing I want to mention is there is an app called Flux. Now, you can just Google it. It's a free download. You can use that on your laptop. You can use that on your mobile. And that just kind of dims the light so that it doesn't affect the ambient light is different. Some of our patients have used that, some particular kind of glasses. Now, I have never tried that, but I don't know whether you get powered ones. And they said that it has helped them sleep. Then, of course, when we talk about melatonin, now Dr. Iyer and I would love to check your melatonin levels, but we don't do that because, it's a specialized testing, and then it's not easy to do that test, costs money, and it's not easy to do it because if you suddenly switch on the light to find your tube, the results are not valid. So what we recommend when you do take melatonin as a supplement is start off with a low dose. Slowly, you can gradually increase the dose to a point where you can, number one, sleep, and number two, you don't feel drowsy in the morning. If you felt drowsy at, let us say, 5 milligrams of melatonin, then probably 5 milligrams is too much for you. You can reduce that. Now, you don't have to worry about overdosing because melatonin is not a pharmaceutical medicine.
I had a young fellow take an overdose of melatonin when I used to work in the ER.
Okay.
And he took 90 of his mom's sleeping pills. Thank goodness it was melatonin. And all he did was have a really good sleep. There was nothing wrong with his heart. There was nothing. He woke up very drowsy the next day and he was fine. So I can tell you, 90 pills of melatonin couldn't knock out a 16-year-old strapping young man. So you can take melatonin. Just in summary, a sleep hygiene process is really critical. One thing is, we look at neuroplasticity, we look at brain programming, we look at habits and habits that last and how to change your habits, how to insert new habits. Your body likes predictability, and we have something called the circadian rhythm. And all of these things are internal programs that were preset already. It's just making a habit and sticking to it. And eventually your subconscious mind just starts to expect things. So if you want to sit and have a cup of tea and relax with your book, and then you go change into your pajamas, and then you brush your teeth, at this point you're dimming the lights in the house and you're getting ready for bed. Then you go do that one thing in the bedroom, and then the other thing called sleep. That's like a predictable routine. If your hormones are balanced, you'll do that every day. Jokes aside, though, you want to just do the same kind of routine. Leave out the email, leave out the devices, and make sure that you have darkness, blackout blinds, tinfoil on your windows. Some people do that.
Yeah.
And the point is, it sounds all silly, but it's so important because even your immune system is protected when you sleep well. Your brain restores and repairs itself when you sleep well. Your hormones reset itself. Your body detoxifies. The list of benefits for good sleep are so much more than just energy. It's metabolism, it's brain health, it's memory protection, all of these things. And we're talking about melatonin. I just want to talk about the melatonin cortisol ratio, Dr. Kar.
Yes.
So, in the mornings, we wake up and we have the highest amount of cortisol. And through the day, it comes down in a little curve like that. We're making little amounts of melatonin through the day, but it's at dusk and then nighttime that the level goes up. So melatonin's doing this, and cortisol's doing that. And we have a cortisol-melatonin ratio. Many, many people have a cortisol curve that's somewhere here in the day, but then it does this at night. And these people, when I see their levels, I say, I know all about you. I pretend to be a mind reader with a crystal ball. And I say, you sleep lightly, you hear everything, you're aware of a lot of what goes on around you. And they're like, whoa. And I say, you wake up and you wonder where the night went. You feel like you haven't slept at all. So they're looking at me and I go, okay, so I already know this. I don't need to spend your money on saliva testing yet. I want you to just try one thing. Do your sleep hygiene and your protocol. No devices before bed. Make sure it's dark. Get a real alarm clock and put a cloth over it. Don't use your cell phone if you can. And then take high dose melatonin, because remember now the cortisol is now higher than melatonin, whereas it should be this way. And so you take high dose melatonin, so you get the ratio corrected for a while until we do all of the other strategies to bring that cortisol down, and then we normalize the ratio and wean you off of the melatonin. So that's one other strategy. If you have a very light disturbed sleep and I ask you to do high dose melatonin, this is why. It's because your cortisol should be doing this, your melatonin should be doing that, and that's your ratio. But here, your cortisol's doing that, your melatonin's here, and the cortisol's higher than melatonin, and you cannot sleep. So other than breathing, meditation, doing all of the other strategies that we're going to share with you through video and podcasts, one quick thing is to do high dose melatonin, up to 21 milligrams, to try and get to sleep and correct that ratio. It's just a short-term strategy. And as Dr. Kar said, melatonin is a master antioxidant. It's also a great detoxifier. Very slowly, we can reduce your heavy metal load even. Exactly. We know that studies show that you can have a 600% increase in breast cancer risk. So it ties into what Dr. Kar said earlier, 600% increase in breast cancer risk if you're low in melatonin.
Yeah, exactly.
So it protects you, it boosts your immune system. You really do need to sleep, and you really do need to know everything you need to know about melatonin. And we're going to make sure you get to know all the right information, not what sounds like a good idea. So everything here is research-based, data-driven, evidence-based medicine. And so we are your team at Better, looking to help you be better through education.
So just one more last comment before we conclude this video. Sleep is not only about melatonin. As Dr. Iyer mentioned, your hormones have to be balanced. And as you know, all your sex hormones like estrogen, progesterone, testosterone, all of them work on your brain. So they are called neurosteroids. So yes, melatonin is very important, but keep in mind that melatonin is not the only thing. There are a lot of other things as well. So more next time. Bye now.